Lung cancer is the leading cause of cancer deaths worldwide. It is the second most common cancer in the US. Most lung cancers do not cause any symptoms until they have spread, but some people with early lung cancer do have some symptoms. If you go to your doctor when you first notice these symptoms, your cancer might be diagnosed at an early stage when treatment is more likely to be effective. So let's see what are the warning signs of lung cancer. But before going to the discussion, you should know that these symptoms can overlap with other conditions and many of them are very common and mild. First thing, you should be alert of new cough, especially if you are a smoker. If it is due to common cold or other infection, then it will go away within a week or so. But if it is persistent for a long time, like more than 8 weeks, then you should think about the possibility of lung cancer.
More people die from lung cancer than colon, breast, and prostate cancers combined. Experts now recommend a yearly low-dose CT scan of the chest for patients who are at high risk of the disease, but this potentially life-saving prescription has been slow to take hold.
In the fall of 2018, Lisa Barbaro developed a deep cough. An X-ray showed no sign of anything serious. Still, her pulmonologist was concerned. Barbaro was a long-time smoker.
Every doctor says you need to quit smoking, and I had smoked for 50 years, but I wasn't quitting smoking.
Barbaro agreed to undergo a screening CT scan to give a more detailed view of the lungs. By early 2019, she got the news no one wants to hear.
She called me and she said, you know, you've got 2 very small nodules on your lungs, one on each lung.
Barbaro had early-stage lung cancer.
As doctors, we're used of having our patients coming to the hospital for an examination, but in screening, we're not dealing with patients. We're dealing with participants who are not ill, who don't have a disease. So most of the CTs are located in hospitals, but there is some evidence also mainly in Europe, in the United Kingdom, where they bring the CT to the participants, where they bring the CT to parking lots of shopping malls, and bringing your equipment to the targeted population, the hard to reach, with very good success.
In Manchester, we put the CT scanner in a lorry and we drove out to the parking lots of the supermarkets where these people usually do their shopping. So they didn't have to go to some strange hospitals, which is a hurdle. We came to them.
Coming from a patient perspective, there is that fear, particularly if there's someone who have had a smoking history, they would know that they're more at risk of developing the disease, and sometimes ignorance is bliss. Also, for a lot of patients, they experience a lot of stigma around the disease, and that stigma can really impact and influence when they might go to see a doctor or engage with anyone in the healthcare system.
The Nelson trial showed that there is a decrease in mortality of lung cancer with about 26% in male smokers and ex-smokers.
So let me just show you an example to illustrate this. Here's a patient who came in for lung cancer screening, and we found a nodule in their right lung, which I circled. Based on the size of the nodule, we recommended that the patient come back in 12 months for another scan. Here's the other scan, and you can see that the nodule hasn't changed. So we can say with a high degree of certainty that this nodule is benign. Let me show you another example. Here's another patient who had lung cancer screening, and you can see that there's a nodule in their right lung about the same size as the one I just showed you. So we asked the patient to come back in 12 months, and you can see that this nodule grew in that time. So because of that growth, we can say that this is a lung cancer.